Hi, all friends in India. My name is DY Suhariya. I'm the ADI Asia Pacific Regional Director. I'm very happy to be here virtually at the ARDSI National Conference, 24th National Conference, New Frontiers of Dementia, Diagnosis and Care, hosted by ARDSI Pune chapter, supported by Chaitanya Institute for Mental Health, Pune. Dementia is everybody's business. The power of civil society, advocacy, and partnership. This is a title that I'm very, very passionate about. And this journey of being a caregiver 11 years ago led me to be a part of ADI, a federation of more than 100 associations around the world that's established in 1984. We're representing our members at WHO, the UN, OECD, and we promote World Alzheimer's Month, September this month. And we published recently World Alzheimer's Report. Our vision is prevention, care, and inclusion today and cure tomorrow. Our strategy, it all started in 1984 for champions from US, UK, Canada, Australia, building the network, increasing awareness, seeking support, high-level advocacy globally from the WHO and UN, leading to the 2017 Global Dementia Action Plan that was adopted by 194 members that increase our multilateral presence, supported by OECD, G7, G20, the Global Bodies Ambassador Program, and lead us to strengthening the regional network at civil society and government level. And at the end of the day, everything that we do always have to relate on the ground. And that's why it's very important for every country to have a national action plan. I acknowledge the National Dementia Plan led by our civil society, ARDSI, was submitted back in 2018 by Mira Patabiraman, the chair then. And we continue to advocate to the government, not only in India, but other parts of the world. But it's a never-ending journey. It's a never-ending effort because every 3 seconds, someone in the world develops dementia. And there is a huge amount of costs. The total estimated annual worldwide costs is over $1.3 trillion, and it will rise to 2.8 trillion by 2030. There are 55 million people with dementia around the world. It will be 139 million by 2050. And we know there's approximately 8 million in India, or less or more. I think the numbers will increase every time we really realize that dementia is not a normal part of aging, and we all have our part to contribute. The component that we contribute is, for instance, it's through advocacy. It is from the Latin word of advocare, speaking on behalf of someone. In my case, I will always speak on behalf of my mother, who was diagnosed with dementia in 2009 and already showed symptoms 20 years before. And as a family caregiver, there's a voice of people with dementia, the voice of caregivers. And this voice is supported and manifested through our work in the nonprofit organization, NGOs, and we're part of ADI, a member of ADI, the federation of all NGOs around the world that work on dementia awareness, care, and other matters. Why do we need advocacy? It's important to provide the data, the facts. The World Alzheimer's Report, as you can see here, the estimation that 75% of people with dementia are not diagnosed. 85% of people living with dementia are not accessing post-diagnostic support. 35% of carers globally hidden the diagnosis of a person with dementia. And we know in 2024, attitudes to dementia that's actually shared by my CEO, Paula Barbarino, on the first day. There are approximately 65% of healthcare practitioners who think dementia is normal part of aging. We all know that it's not a normal part of aging, and the numbers are staggering. So why do we need advocacy? Because through prevention or delaying the onset of dementia, it's really possible to reduce the number of people seeking care and thus reduce the care cost burden. 45% of dementia could be delayed or prevented by addressing the 14 modifiable risk factors: less education, hearing loss, high LDL cholesterol, depression, traumatic brain injury, physical inactivity, diabetes, smoking, hypertension, obesity, excessive alcohol consumption, social isolation, air pollution, and visual loss. The IHME predicts that improved access to education could lead to 6 million fewer cases of dementia worldwide by 2050. And this decrease would also be offset by a projected 7 million additional dementia cases linked to projected rates of obesity, high blood sugar, and smoking. So there are all these challenges, the problems to be solved on stigma, lack of care and treatment, low diagnosis rates, and absence of information. So this is the importance of advocacy. We build partnership and alliance. We link up and strengthen partnership through research and analysis. We lobby key stakeholders and we educate people, and we do grassroots organizing or campaigning, all for the aim of behavior change, the mindset that dementia is not a normal part of aging, and there's many things we can do to create a good quality life in our society. So developing a successful advocacy campaign requires these following key elements that I mentioned earlier: data, you connect the dots, you meet people, you identify the champion who speak, and you also establish a call to action. The partnership we have so far, we have built partnership with WHO, HelpAge International, ASEAN, OECD, United Nations, and NCD Alliance, and many more. So the role of civil society for people living with dementia and carers, we provide information and provision. We provide support services and advocacy and awareness raising. And ADI, as a federation of more than 100 associations around the world, including ARDSI in India, we support civil society, including ARDSI, and we basically empower and engage with all of our partners around the world. In terms of our support to civil society, including ARDSI, we actually explore the support through capacity building, information provision, policy, research, partnerships, accreditation, and we also provide all these content that you can use to pass on to your network, that you can also use in your conference, the data and all details related to dementia. As I mentioned earlier, in 2017, 194 member states agreed to adopt the Global Action Plan on the Public Health Response to Dementia. And there are 7 action areas in this Global Action Plan. Dementia is a public health priority. We always urge all countries to have a national plan. Dementia awareness and friendliness, dementia risk reduction, dementia diagnosis, treatment, care, and support, support for dementia carers, information system for dementia, and dementia research and innovation. The WHO Global Action Plan aims for 100% countries have at least one functioning public awareness campaign on dementia to foster a dementia-inclusive society by 2025. This is the map, global map on this work on advocacy. And this is a photo. I had the pleasure to meet ARDSI chair and the entire team in New Delhi. And it's actually the connection that you have amongst people that you know, in this case with our member in ARDSI, it continues. It's basically something that's inspiring what you're all doing, especially in World Alzheimer's Month. There's many initiatives. I know ARDSI has updated me with all these activities. In Goa, there's a screen for the movie Life Flows, directed by Vishal Nidyanan. And there's the Atul Setu, lighted up in purple, the river of Mandovi. I know there's all these initiatives in Mumbai, in New Delhi, in Trivandrum, in Guwahati, in Kolkata. The landmark station is lit up in purple. And your Ministry of Health tweets on dementia and World Alzheimer's Day. And there's also an initiative in Mizoram chapter, a public meeting, free clinic, all these initiatives, including this amazing group of people, Narendra, Renu, and all the friends, Reva, Bina Berry, you know, people that actually are so passionate. I'm sorry, I can't mention all names in this occasion, but I identify and I acknowledge all of you that you're working from the heart. And this is why ARDSI actually is our member. You're a member of ADI since 1994. We also work together on STRIDE, Strengthening Response and Dementia. And we continue together on the advocacy work on National Dementia Plan, advocacy and awareness raising globally. So ADI support to civil society like ARDSI, as you can see here, my CEO, Paola Barbarino, with the ARDSI chair, Renu Vohra here. And we have Narendra accompanying me to meet your ministry, high-level people. And there's this meeting, the Asia-Pacific Regional Meeting that was conducted back in 2022 in Taiwan. We all connect the dots and strengthen each other to support people with dementia in our region. And we have approximately 19 members in Asia Pacific. And we actually always have a regular meeting and exchange thoughts and ideas and support each other. So in September, World Alzheimer's Month, the hashtag is Time to Act on Dementia, Time to Act on Alzheimer, and the theme is actually on attitudes to dementia. This conference is so important because what you're doing is actually spreading the information, helping people to understand more about dementia, contribute your skills. And the campaign this year is seeking to address and educate on the stigma, discrimination, and misinformation, which still surrounds the campaign. And it's happening in online, in the media, and through all these events, as I mentioned earlier, not only memory walks, but all these landmark lit up in purple, public speaking arrangement, the free clinics, early detection screening sessions, everything. It's all aimed to help people with dementia in your country and create much more impact in the region as well. The more people talk about this, the more people with dementia and family caregivers will have a good quality life. So Time to Act on Dementia was launched on the 20th September, a few days ago. The focus is on attitudes to dementia. We surveyed approximately 40,000 people living with dementia, carers, healthcare practitioners, and the public on their views of dementia. Again, I believe my CEO is sharing some inputs and summary results of the report. And I believe it's also something that you can download in our website, alzicont.org. And please use the hashtag Time to Act on Dementia, Time to Act on Alzheimer in contributing your voice in this World Alzheimer's Month. So it's stated that we will be launching this on the 20th September, but we already did because this is the 27th and 28th September. And this is the QR code that was actually the event, the webinar, when we launch it. So please follow us in our social media, our Twitter, our Facebook, our Instagram. And it's basically everything that you do to support people with dementia means a lot, as simple as spreading the information, sharing a particular data, and we have to hand in hand support people with dementia, family carers, all for the improvement of quality life. And this is why dementia is everybody's business. It's affecting every single elements of our life, and every action counts. Thank you for everything that you do and for your support for people with dementia and family carers in India. Thank you.